in, and that's great, but we have a jam-packed agenda. So this is Jody Dvorkin. I'm Tanya's second little peanut pod here, and we're good to see all of you again. Thanks for joining us. Just a reminder about Zoom. Use the video if you can. We know it's lunchtime. Don't be shy, but respect if you don't want to. More importantly, please introduce yourself in chat. And definitely, please come online if you have questions or comments. We really want this to be a discussion after the presenters talk. So please join in, ask them things, give input from your organization's perspective. That's what makes this conversation really rich. Remember to unmute. I always forget to, so I probably will do that again in this talk, but that might be one of the problems if we can't hear you. So again, it's Tanya and Jody from ICSI. And I'm excited to show you the agenda for today. Oh, and I do just want to do our antitrust reminder. ICSI has a strong antitrust policy, so if the conversation is veering towards something of a pricing nature, please raise your hand in chat, speak up, and let us know, and we'll steer it back in the right direction. So we have 3 exciting presentations today. We have HealthPartners talking about their Essentials to Go program. So Valerie and Michael are here with us to present that really cool, exciting work. We have Jen Bolton from Vail talking about their perspective and what they're doing for the community, and then their staff. And then from Essentia, we have Gina Dixon talking about their grief support services, which has existed prior to COVID, and as with everything, has now been adapted for COVID. Then we really encourage you to have a discussion, ask questions throughout, and then we'll wrap up showing you our website and where things stand. So want to do a quick reminder. We have our checklist of stressors that we created, recognizing that would evolve and change over time. And it's really hard for all of us to anticipate every stressor that will come along. And so for those of you who have been watching the news, you might have seen that there is now an Asian giant hornet that has made its way to the United States. And now Tanya's from Minnesota. She didn't know about it. It's not bothered by insects. I'm from Florida. I'm used to lizards. This completely freaks me out and totally stresses me out. So everybody's unique. But like anything in this work, there's going to be things in the news cycle, things that affect individuals. So there's going to be a lot of stressors we can't anticipate. We just need to kind of embrace that that's the case and continue to move on. I will point out it's about 2 inches. This thing is big. So it's on the West Coast now. Hopefully it doesn't make it to us, but we'll see. We'll just roll with the changes. So with this, I'd like to kind of just roll right in. We have 3 presentations. After each presentation, we will stop and give you a moment for questions. You can also type questions during their presentation, and Tanya's going to be looking at the chat. So we have Valerie and Michael from HealthPartners and Regions Hospital with their exciting program, and we're going to let them share. Valerie and Michael, can I turn it over to you? And I know they told me they might have a little bit of challenges. It's less Zoom friendly where they work. So they were a little bit worried.
Let's see, I'm going to go ahead.
Can you hear me now?
Oh, yeah, perfect.
Okay. All right. This is Valerie. I am the Retail Operations Manager at Regions Hospital, and I'm joined by
Michael White, Dave Chef.
And we are pretty excited to present to you our Grocery to Go program that we have implemented here at Regions Hospital for colleagues. If you want to go ahead and go to the next slide. This is a sample of our kind of communication that we put out to the hospital, and a little bit of why we're doing it. We wanted to be able to offer a variety of essential grocery and pantry items to our staff, and we also have some CSA type produce boxes that are available as well. And if you see on the slide, the cafe.640.catertracks.com, it's very simple, easy. If, even as we're sitting here right now, you can get to it on your phone, you can get to it on your computer. No downloads of anything needed, so it's really simple. You can do slide 3. Driving factors for this, of course, were, to kind of help with the well-being of our colleagues, help alleviate some stress of having to stop other places after a long day at work, ensure that they're going to have some fresh, healthy options that are readily available, and then also ensure that they have a little bit more time to spend with their family and themselves. We also realize that we have the access and ability to obtain the items that people may need and may have not been able to find in grocery stores for a little bit. So we wanted to be able to help with that. And we've been able to do that without added expense to our department as well, which is kind of nice. We utilized platforms that we already had in place and also labor that we already have in place. You can go ahead and move to the next slide. We were fortunate also that our vendors worked with us to kind of help us to procure things that normally we wouldn't get. And then we also used our existing online catering ordering system. Our vendor kind of flipped the switch on what their website usually looks like and built a whole new website for us to use and to be able to offer this to our colleagues. If you go to the next slide, that's going to kind of show you a little bit of what you see when you log in to CaterTracks. Again, cafe.catertracks or cafe640.catertracks.com. Again, very easy and user-friendly. You're just going to click on Start Your Order, and that's going to open up to the next slide, which is our offerings for our groceries. So the essentials, you know, not a wide variety right now. We kind of wanted to keep it simple and keep it to the basics, and we'll grow it as we see the need. And we were able to keep our pricing relatively low, you know, as just not really looking to bring an income in for this, more to offer something for our colleagues. And then if you go to the next slide, that kind of shows you a little bit of the Bix boxes, which are, like I said, they're kind of CSA type boxes. Our vendor Bix puts these boxes together for us. So they come in already pre-done. Our customers order them 2 days in advance, and then they come to the cafeteria to pick them up. And these have been a huge hit. They've been a big seller. I personally got the fruit and veggie box last week, and it lasted about 3 days at my house before it was completely gone, and everything was fresh and delicious. So that was a really good option that one of our vendors had brought forward. The challenges that we had, of course, at first, kind of building trust in the quality of the produce. I know a lot of people don't like to buy produce without kind of touching, seeing, smelling. But as more people have started to order, word of mouth has gotten out how good and fresh and delicious the produce was. Generating awareness also has kind of been an issue now with the social distancing and some of the things that are in place. We're not doing huddles as much anymore, so generating awareness has been a little bit of a struggle, but we're getting there. And then also trying to come up with a plan to implement it, like I had said earlier, with no added labor and expense to the department. And we've actually been able to do that. And then, you know, I think that thinking outside the box during these times to kind of help support your staff is very important. And always kind of start small and grow your ideas and programs kind of as you can, I think is big. Okay. I think that's about it, unless somebody has a question. Oh, I see in the chat, central location, yes. So they order online, and then they're ready for pickup. The grocery to-go essential items are ready for pickup in the cafeteria, and they choose a pickup time. And then they pay for it in the cafeteria as well.
So Valerie, this is Jody. You talked about kind of generating awareness. So what did you do in the beginning, and then what have you changed to try and get the word out there?
In the beginning, I created the second slide in our PowerPoint. I created that. We have some digital menu boards in the cafeteria and in my coffee shop. So I created some digital signage that went out there. I also created some business cards, really simple business cards that just say grocery to go with the website on them to have my staff hand out to their colleagues and customers. And since I have reached out to, I also put it on the My Partner page for HealthPartners. And since I have reached out to communications, and they're also willing to put it on the hospital-wide digital screens. And then I've also put it in the huddles and a couple of other things. I've been working with communications to get it out there.
Great. And another question from the chat: what hours is the grocery open, and can staff who get off shift late pick things up on the way home?
They not an overnight late night shift. You can order it anytime. Pickup begins at 7 a.m. So if they get done with their shift at 7, then yes, they can stop down in the cafeteria and pick it up.
Fantastic. And one more question: in terms of evaluation, how are you tracking and then evaluating what's successful? You know, what numbers are you looking at, quantities?
You know, right now it's fairly new. We've only had it for about 2 weeks. So right now we are looking at, you know, I can run some sales reports from the CaterTrack's website to just kind of see how well it's going, what things are selling better, and we'll kind of modify our offerings as we go based on need. But right now our biggest sellers are the Bix boxes by far.
That's really interesting. And I see Melissa from CentraCare says that CentraCare has implemented this as well with a pop-up market with the essentials and then also full-size pizzas to go and family-size meal options. Melissa, are you able to just on the line say how this is going, how long you've been doing it for?
Hi there, can you hear me?
Yes.
Yes, I think it's been for a couple weeks, maybe a little bit more at our St. Cloud Hospital location where they have the pizzas and the full-size meal options. And then I work out in Monticello, and we implemented just pop-up market with the essentials, and they've added potatoes, and I mean, they've just gotten a really great response, and then 24/7. And so we do have a kiosk in our cafeteria that people can use even in the overnight hours. So it's been pretty well received.
Fantastic. Well, this is really exciting to hear. This is really great. We've been wanting to talk about addressing basic needs, and we're really glad to kind of see this in here. So think if you have any more questions, Valerie, Michael, thank you for kind of sharing this, and we're excited to see how it evolves. 2 weeks, so it's still kind of in its infancy. So it sounds like this is really gonna get bigger and bigger. So thanks for joining us.
Thank you. Thanks for having us.
Thank you.
Thank you. I'm going to shift over. We're going to move to our next presenter. We have Jen Bolton from Vail Place. And so I have asked her to talk a little bit first to tell what Vail Place does and its offerings for the community, and those services, obviously as a community, affects healthcare workers as well. And then to talk about what she particularly has been doing for their staff there. So Jen, if it's okay, I'm going to turn it over to you and keep this rolling.
Yeah, absolutely. Can everybody hear me?
Yes.
Okay, great. Yes, thank you. So we are, Vail Place is really excited to be here and to kind of talk a little bit about what we do. I've been sitting in on the ICSI presentations for the last several weeks, and have learned a lot, I think, from kind of hearing all the different perspectives of everyone. I'm excited to share a perspective from a smaller organization and a community-based provider. I think we are encountering a lot of the same challenges, but I think they just, the impact to us is a little bit different, I think based on size, and you know, some of the things that we're dealing with right now are certainly resonate with the same issues that are seen in kind of larger systems, but it kind of has a little bit different twist for our programs and our population. So you can go ahead. Thank you. So just a little bit about Vail Place. As you can see, we have 39 years of experience providing community-based services for adults with mental illness. So our work is typically non-treatment focused. It's more focused on social determinants of health, basic quality of life, and really the things that occur after someone gets out of the hospital or after they've had a break where their mental health has become incredibly challenging. So it's connection, it's reducing isolation, it's getting help accessing benefits, finding housing, employment, working on kind of whole health care, really just a variety of different things, but it's the stuff that once you leave the hospital, the things that help keep you stable and the things that help you move forward with your life and pursue recovery. So that's a big focus for us and is kind of at the core of everything that we do. So our key programs, we have our hands in a lot of different areas, but we like to think that we have a good comprehensive approach to grouping all those things back together as well and making connections between our programs. So it's very common to see someone involved in 2 or 3 different programs within our organization. It's not siloed, and that just allows for even greater collaboration and coordination. So case management, community support program, housing, we have a residential program, as well as Vail Care Behavioral Health Home, which is a team-focused community support model focused on addressing whole health issues. So beyond mental health issues, but people with chronic illnesses and different things like that that need additional support to address that and their mental health concerns. So, and then a number of integrated care initiatives. So we are proud to say that we're small but mighty. We served 2,700 people, over 2,700 people in 2019, which you can go ahead and move on to the next slide. You'll see we're doing that with a $6 million operating budget and 80 employees. So we have 4 primary service locations. We also own an apartment building, and we have additional staff working out of different partner sites. So kind of looking at the breakdown of the nature of our work, about 75% of our direct services are provided one-to-one out in the community. So it's a lot of people meeting with people in their homes, meeting with people at appointments or taking them to appointments, transporting them places, making sure they're getting to their psychiatrist or their doctor, or they're getting a lab done, just a variety of basically whatever it takes to help kind of meet their needs and address the biggest issues for them. So with 80 employees and 75% of them, that they're really out in the community a lot. And the other 25% of our services is really more center-based. So it's coming into one of our programs and being part of a collaborative community that works together. So I'm sure you can start to see how these things become a challenge for us as a provider in the face of COVID. We're high touch, high relationship, face-to-face contact is really critical to what we do. And so this has been a whole different world for us. In terms of our leadership priorities, we have a long-standing tradition of really being highly focused on innovation, opportunity, adaptability. That's really at the core of who we are. We like to be able to respond and adjust to what's going on around us and not just say, that's not our area or that's not what we do. We try to find a way to problem solve, and why can't we address that issue? Why can't we work on that? So that's just inherent in how we approach our work. We also have a super high priority on both building a healthy work culture and making sure that we're fostering healthy community employee engagement. So for us, that looks like things such as we have a long-standing commitment to employee appreciation and recognizing employees in several different ways. We have course, the training in emotional intelligence is an established practice for our employees. So everyone either has or will be going through emotional intelligence training, kind of a 4-part series of intensive training. It really sets the stage for how we communicate and how we operate together. So that's a core piece for us. We are proud to say that we were a 2019 Star Tribune Top 150 workplace. And we were, it was our first year applying, and we were thrilled to be included in that selection. And we have high hopes for 2020 as well. So probably the biggest thing that I will say just kind of about our workforce is that we have made an intentional decision at the start of the COVID conversation to do everything we could to prevent layoffs, furloughs, really doing what we could to maintain our workforce as much as possible. We have a very clear sense that the needs don't stop. And so we needed to find the capacity to respond, be ready to respond, and to grow with the changing needs, and be ready to go again once the stay-at-home order was lifted. So we've worked really hard to make that happen. And so far I've been successful, and I've actually continued to grow and are adding new positions at this point. So a different story that I think than a lot of other providers might be seeing out there. Jody asked me to talk a little bit about kind of the impact of COVID-19 on our services. So it's all kind of laid out here. I think across the board, across our programs, we are certainly seeing an overall increase in total served. So our targeted case management program is about 40% of our workforce. If we compare activity in January to activity in April, 18% increase overall in total served. 19% increase in total number of contacts. I mean, you can see but what interesting thing that we're seeing there is an increase in the average number of referrals per week, so getting new clients, but also a decrease in the number of discharges. So we're not closing out clients. And so it's, people just aren't closing out of services, but the referrals keep coming in. Targeted case management is an essential service at the county level, and so they can't establish a waiting list. They can't say, no, we can't take anyone. So therefore, then that refers out to providers to be continuing to take on new clients as the needs are identified. Similarly, with our Vail Care program, over a 25% increase in total number of contacts in April because compared to January. So really a significant increase there. And the number of referrals doubled in April. Part of that was us internally making some referrals of people that we could close off of targeted case management that could be stepped down from that into a different level of service being transferred over. But again, just people who previously had access to supports out in the community now are more isolated, and things are popping up that they're needing assistance with. Our integrated care initiative, similarly, huge increase in the number of contacts there as well. And then looking at some of our more internally focused programs, so our Clubhouse Community Support Programs, these we have 2 locations in Hopkins and Uptown that are their 8 a.m. to 4:30, sometimes 7:30 p.m. every Monday through Friday sites that are open. People are in the door, in and out throughout the day. And on March 16th, we completely closed our doors. So the entire core of the program is focused around everyone coming into a central site and working together to connect, to work on things that they want to work on, to build skills, all those different things, and that had to be completely shut down. And then we had, we average between the 2 programs about 70 people per day coming into those locations. And so then we basically had to tell those 70 people, and not the same 70 people, I mean, people vary on the days they're coming in and out. Sorry, you can't come in. We need to completely shut down. And so we immediately flipped to what they have been calling virtual clubhouse, which is efforts to reach out to people electronically. They're doing multiple meetings through during the day through Zoom, where they're connecting and getting on face with people, and a number of creative, really interesting projects that they're working on there to try to build engagement and connection for a community that is supposed to be together, even when we're apart. So that's been a really incredible growth, a change point for them. And it's interesting to see that even despite having closed their doors, they as well, in terms of number of contacts and number of people interacting with, have seen over a 25% increase in April as well. So again, more people accessing and seeking these services. Vail House is a residential program. That is a 22-bed facility. We're really, so far, have been grateful to not have any diagnosed cases of COVID there, and are taking a lot of precautions, but there are certainly a lot of challenges with that. Supportive housing services is helping people find and maintain their housing. And so similarly with that, it's really about helping people access housing. And so in an incredibly challenging market right now, and in a really strange time, we were excited to learn that our housing staff actually housed 9 people in the month of April, which is quite a bit given the market and given the challenges of affordability and things like that. So always love to do a little bragging about our services, but obviously our point here is to talk about supporting our staff during COVID. So we have tried to take a really intentional approach to building connections and building relationships. Again, relationships are really at our core value for us, and that is relationships with individuals served, it's relationships and partnerships in the community, and it's also relationships with our employees. They are one of our most critical assets, and we could not do the work without them being willing to put themselves out there and do the things that they do on a daily basis. And so we really wanted to be mindful and thoughtful about how we care for them during this time and stay connected, so that with all of us not together, we still had ways to connect to each other. So one of the big things that we did was implemented virtual meetings. So it had been kind of on our roadmap to implement Microsoft Teams. And it was something that we were going to be doing thoughtfully and planfully and take our time with it and, you know, kind of get it rolled out by midsummer to end of summer. Maybe we'd have everybody up and running. And then COVID hit, and we implemented it in less than a week. So we made the decision and kind of started planning on March 11th, and by March 16th we were doors closed and completely remote. So it was a fast turnaround, but people adapted to it amazingly well, and have really there's been a lot of natural development out of that as far as staying connected. You know, I think we had an atmosphere that was already pretty remote in terms of people out in the field a lot, not all together at the same time, but without having the vehicle for people to communicate, I don't think we realized what we were missing. I think staff are now reporting that they're actually feeling more connected than before because there's a vehicle and a space for them to communicate with each other. So, you know, there's an all staff chat where people can go in and just post comments, different things like that. And you see everything from look at my adorable kid to look at this bird outside my window to, you know, to people asking serious questions and things like that. So it's really everything across the board, but it's just a way where everyone has kind of been able to be human together and communicate together, which is really, I think, important when we're all so far apart. You can see on the little graph there, that was our March stats for Microsoft Teams utilization. So literally it was just not being used. And then we had a huge spike in those last few days of April or March, where everyone just kind of jumped on board. So it was incredible to see that. We've also been intentional about making intentional check-in points. So for example, like with my team, I have developed a process of every morning I'm connecting with my entire team and asking them to just kind of let everybody know what their top 3 priorities are for the day. So it's a way to intentionally make sure everyone's connecting, and we also kind of have an awareness of what's going on in each other's worlds. The theme days that are on there, you'll see those funky pictures. That's our leadership team. And so we implemented these theme days as a once a week thing to just to try to inject some fun and again, some unity with everyone. And it was something that had kind of been on the books to start doing a little bit prior to COVID. Our HR coordinator is a huge houndstooth fan. And so we had to have a houndstooth day. So he just took the initiative and made it happen. And that was a really incredible opportunity. It was just fun to see everybody kind of jumping on board with it across the agency. And so we've now continued that throughout this as kind of a weekly thing. So we've done animal print day. You can see from the photos there, we had a hat day one day. We've done flannel day. Last week was back in black. And so it's just simple things, but it's still just everybody gets a kick out of, you know, just that small thing. And then we're posting photos on the staff chat and everything. And it's just a way, again, to keep people engaged and to remind people to take joy in the things that we do. So things that we've done to support our staff during COVID, I think a few key things that we've done. So one is really being intentional about continuous communication and really consistent messaging so that everyone's speaking the same language, so that we have multiple people who are voices for the agency, but everybody's kind of carrying along the same thing. And we've been really thoughtful and intelligent about that and coordinating our messages. So our executive director has been doing weekly updates, which have been incredibly inspiring and reassuring, I think, to everyone. And we've gotten feedback that they really, really appreciate that. I think one of her key messages early on was, please take care of yourself so we can all take care of the people who need us. And that has really been kind of a consistent theme for us as well, that we're making sure that we're doing that. In terms of workforce management, we've had to adjust our onboarding and orientation processes. We're trying to minimize COVID exposure risk. So a really thoughtful protocol for anyone who potentially is considering going out and seeing someone face to face, that there's a really thoughtful, you're talking it through with your supervisor before you make the decision to do that, and really thinking through what your options are just to completely avoid the risk. And then making sure if you're going out, what protections do you have in place and what can you do? So, and the other thing that we're trying to do in terms of managing our workforce is really trying to focus our outreach on specific known kind of risk groups for us. And by that, I mean, so for example, for us, being a smaller organization, we've identified that parents with minor children is actually a pretty big workforce risk for us. If we have 2 or 3 or 4 case managers who have minor kids who are not able to work because they have to make sure their kids are taken care of and they don't have daycare and they've got to get them through school, that has a massive impact on the entire organization or on the entire team in terms of covering for those clients. Again, the needs don't stop, so we have to adjust. And so we've tried to be really intentional about proactively reaching out, getting an idea of people's areas of need and potential concerns, so that even if they don't have an issue right now, we're aware of what our potential risk is and we can kind of keep a little closer eye on them. We've really encouraged use of our EAP, which has been incredible in terms of helping provide resources. We saw a significant uptick in EAP use in the first quarter and are expecting similar in the second quarter here. We haven't seen that quite yet. We also are creating a wellness site, or have created a wellness site that's just kind of getting kicked off the ground with, basically the theme is wellness strategies in a remote work world. And so we're trying to focus on some key areas: communication, productivity, leadership, some of the professional stuff, but also self-care, everyday life, parenting stuff, to try to give people a connection to some simple resources. In terms of gathering feedback on staff support needs, we're doing that a lot of different ways. First and foremost, we really rely on employees and then getting feedback from them. We have an established open door policy. We really make an intentional effort to be very, very open door and accessible. So we encourage, and that's something that's been in place for a long time. So we feel like that gives us an advantage in people feeling comfortable coming to HR or to their supervisor or to leadership with different things. People have easy and direct access to the HR team. Myself, our HR coordinator, and our executive director are kind of our 3 key people on our HR team. So people know that they can contact any of us. We're also keeping an eye on responses to posts, chat conversations, things like that, just to see if things are bubbling up. Our supervisors are meeting with their teams frequently. We kind of rely on them to take the temperature and to let us know if there's things cropping up. We have good communication channels in place with leadership meetings and everything to be gathering feedback and kind of hearing from folks. Again, the HR team is proactively reaching out. We're monitoring EAP utilization. Similarly, we again have a really good established relationship with employees as a resource. We've tried really hard that HR isn't the scary people in the corner. We're here to help you. And so we think that's been really helpful. And then really our agency leadership, we just really try to be transparent, factual, hopeful, continually demonstrating appreciation for people through words, comments, small actions, things like that, just to let people know that we know how hard it is and we know how hard they're working and we appreciate it. So in terms of future growth for us and kind of future planning around supporting staff, continuing to expand and promote our wellness resources is going to be a big thing for us internally. We've found that, there's a ton of resources out there and you can Google ideas on just about anything, but trying to find a way to tie it to our overall themes and our overall values of resilience and self-care and some of those different things. So we're trying to kind of cultivate a set of resources that resonate with kind of the things we want employees to be thinking about, as well as connecting them back to the benefits they already have. Our EAP, our primary care support services, some different things like that are already there. Again, benefit for them, and it's an investment the agency is already making. So we just want to make sure we're reminding them of those resources that are available. We're trying to firm up our communication process and time off process for people who maybe have FFCRA needs or just need time off. And that's been a big conversation the last couple of weeks, has been people just need to take a day off. People need to recharge, and the work will still be here, and you will feel a lot better if you just take a day. So we're trying to encourage people to target different employees who seem like they're getting a little crispy, and maybe suggest that they just take a day. And the feedback has been that when we do that, people come back better. It really does actually help just to take a day and to do those things. And we have very generous vacation policies, and so we really encourage people to use that. But I think at this time, there's a balance between, how do you know how many needs are out there? It's hard to walk away and say, no, I'm not going to do anything today, but everything will still be there tomorrow. So we're trying to really reiterate that. The virtual work is going to be a continuous thing for us, and something that we don't see going back to quote unquote normal in the future. I mean, I think it will be an ingrained part of our world going forward. Some shift to somewhat virtual work. There's no stepping back from it once we're there, and so we're realizing that's gonna result in some overall changes to agency norms and practices that we need to be thinking about. And finally, the reopening conversation has been very enlightening, but it's also stirred up a lot of anxiety for folks too, as well. What does this mean for us now? We've been fairly safe at home. Now, what does it mean? All those different things. So we're trying to, again, really clearly message that we're proceeding slowly, we're being thoughtful about this, and that safety of employees and individuals is our #1 priority. So I think that's it. I think that's my last slide. So sorry I talk so fast, but yeah.
And fantastic. Thank you so much. This was really thorough and helpful. And I'm really motivated by the themes. So I'm excited. I'm thinking we're doing 80s theme in my workplace. My hair is already kind of an 80s hair, so it will take up the entire box when we do it, but we'll give it a try. We have one more speaker. I'm going to move on in a second, but I do have one question for you, Jen. And please, if you have questions, type them into the chat. But we spoke about this a little bit in that, targeting parents with, young kids, and that was important, and how you balance that with not having other workers get upset that maybe, one segment's getting special attention. So a quick thought on that.
Yeah, I mean, I think it goes to, we have a really established team culture. And so I think we already kind of we're lucky to already have kind of some of that in place where, we're all in this together. There's no I. And I know it's a cliche thing to say, but truly we have kind of built that out in how we do our work, is that we're all here as a part of team. And I think it helps that we have a very flat approach to hierarchy, where it's just as likely to see our executive director in getting her hands dirty and moving boxes as it is to see anybody else. And that's just a piece of who we are. And so I think we've kind of normalized the team atmosphere in a way where I think that steps off some of that, and just being mindful of everybody's got their stuff and everybody has their challenges. And I think if we just go back to kind of the how do we build resilience and emotional intelligence for people to step back and look at the bigger picture of things, instead of getting bogged down in the details. So it's not always perfect, and certainly people have challenges and get frustrated at times, but we just try to keep really open communication and encourage people to look at the bigger picture of, we just need to get the work done and we need to help the people who need us. So.
Fantastic. Thank you so much. This was wonderful. Please type in if you have questions for Jen, and I'm going to shift and turn it over to our next speaker. We have Gina from Essentia. She helped establish their grief support services that has existed pre-COVID, and now they've made some changes. So we asked her to talk a little bit about what the program was, how it's changed, and then give you all some tips about grief support for if you don't have a program, which many institutions don't, some things to think about. So Tani, do you have those slides up? Okay, I can go ahead and pull those up. And Gina, you're on the line. Do you want to just introduce yourself while I pull up the slides? Up.
Unmute.
Perfect.
Can you hear me now?
Yeah.
Lovely. All right. Well, thank you so much for all the collaboration that I've been hearing this hour. And I'm going to apologize. I definitely need to be done at 1 o'clock because I have a patient then. So as program manager, I also have an active caseload as well, which I think is an asset in being able to support my team and understanding the unique challenges that they're facing in this world of COVID and virtual visits and all of that. And it can also pose some challenges in terms of juggling those competing needs at times. So I will just start by saying that our greatest strength in the midst of this COVID crisis has been increased collaboration and teamwork. And I'm a part of a greater team. And go ahead and go to the next slide. Grief Support Services is physically located in St. Mary's Medical Center. We're out of Duluth. And we were actually likely one of the first hospital-based grief support centers in the country. We're celebrating our 35th anniversary. And so the program began with our program founder, Ben Wolf, known and beloved by many. He started out as a singular force in terms of supporting both staff and the community related to grief and anticipatory grief concerns. And since that time, I've been with the program 25 years. I'm also a licensed psychologist by training. And our program has grown. So we now have 3.6 FTE staff for the East region. And that includes 2 LICSW therapists, myself, and our department coordinator, who keeps our ship running. And we also have about 40 volunteers. I'm just going to focus on staff support today as opposed to the outreach that we do in the community, but know that that's a big part of our program as well. And that includes a school crisis response and other ways we serve the community. I'm going to talk more about our peer volunteers in a moment. They are really key in responding. And we also have 11 support groups for the community that we're transitioning. We've had some test cases for virtual groups, and so we're starting to train staff and expand those services via Zoom. So as other people have said, in COVID time, it's like every day presents a new challenge and a new opportunity to do things differently. There's such a rapid rate of change. And I will say that our grief support services team primarily serves that East Market. But in the midst of COVID, we're doing a lot more training and collaborating with the West and Central markets. And I'm going to talk about that here in a minute. So pre-COVID, what grief support services offered for Essentia Health East staff was free grief therapy visits at no charge. And that was like a EAP type program. And it was face-to-face within the medical center. Right now, all of our staff are working remotely. Some of that is because some of our team have young children and they're needing to work from home. Some of that has been out of concern for pre-existing health conditions. And just because we're such a small team, it's really important that we stay well so we can support the system. And so we're trying to reduce those risks of exposure as much as possible. I mentioned free grief support groups. Traditionally, we've offered a service of remembrance to honor employees who have died in the past year. That took place within our chapel. It included very excellent support from our administration, who would participate in that service, as well as for each employee that died, we invited a colleague to speak in remembrance of that person for a few moments and light a candle, and share some stories. And that has been very well received over the years, because sometimes, well, I mean, you all know that some people don't have access to attend a funeral, or particularly when it's been a traumatic death. Some families have not offered a funeral altogether. And so coming together as an Essentia family is really been a validating acknowledgement of the importance of our team members. Uh, Other ways we have historically supported staff includes a Families Remember with Love service, both for our employees who have experienced pregnancy or child loss, but also for those peds or birthplace staff that are grieving the death of a pediatric loss or NICU or birthplace. And so that is something that we've been doing. Wow, I think we've been doing that at least 34 of our 35 years. And we have a great deal of printed grief literature on our website. If you just Google Essentia Health grief support, you'll find that there are lots of free downloads. And unfortunately, with COVID right now, we have a grief resource library that's attached to where our support groups met, and that's just been shuttered. You know, that we're looking at new ways of sharing resources and information, but that's been a great resource that included professional grief resources as well as for patients and families. And consultation has long been a part of what we offer, just for, you know, doctors, nurses, any employee, to touch base regarding a patient concern, either to have inpatient visits with the patient, or supporting that staff in supporting families at end of life or at the time of a diagnosis. Or, you know, we have a fair amount of trauma events in our neurotrauma intensive care unit, and with some, you know, pretty difficult outcomes. And so supporting in that. And then, of course, providing grief, trauma, and loss training. Sometimes that's been, you know, part of those annual trainings that are offered, and very often it's just as new needs have arisen, and certainly with COVID, you know, that's been true. I mentioned our peer program. I received training through the Johns Hopkins Psychological First Aid program, and then brought that training back to our team in 2017. And the goal of our peer program is to provide free confidential crisis support and stress management strategies following stressful impacts or stressful events that impact our employees. So that would include, the scope of that would include the death of a patient, the death of a coworker, or adverse patient outcomes, particularly on the birthplace, when there might be injury to a patient. Next slide, please. And so we have a team of 30 peer volunteers, and that includes physicians, nurses, chaplains, social workers, and you know, just we have people from the pharmacy, or people that maybe work in an office registration area that have been trained in emotional first aid strategies, and then are available to provide that confidential support, and are also then available to triage or to help people get to a higher level of care if they need therapy or that sort of thing, EAP. But really, at the heart of it, it's being a caring, validating listener and help create a culture where we have a deep amount of respect for the impact of the work that we do, and that we get to be human in the midst of that, rather than necessarily valuing stoicism. And so as those peers provide that support, they do that individually with group debriefings. We try to aim for within normally 24 to 48 hours after an event. Educating managers about when to reach out for peer support and to organize a group debriefing has been a big part of the work that we continue to do. And I must say the culture in some departments that there's a great amount of utilization, and then we still meet people in other departments who have never heard of the peer program. So it's since 2017, it's a work in progress. We also provide leadership mentoring, so helping managers support their team when something really difficult happens. And then again, we have those printed stress management resources. So pre-COVID, we literally had like a first aid box that we would carry printed resources to share and leave behind. So adaptations. We have rapidly switched over to virtual visits, both for our outpatient therapy, but also for peer support. And we are continuing to provide on-site support through our chaplains that are also trained in EFA that are embedded in those units. We have our CPE staff, pastoral education, that are providing twice a month support group for chaplains and grief support staff. We're having a daily huddle. Before we'd have a twice a month team meeting. We're still having that, but we've upped our game and we're checking in with one another daily as situations are rapidly emerging. And we have really increased our collaboration across the West, Central, and East markets, as well as improved collaboration with our behavioral health colleagues, the Wellness Committee, chaplaincy, and organizational learning and development for a more comprehensive COVID response. I believe that Jackie Bublotz is on this call today, and I'm really hoping that she has the opportunity to share about some exciting new things that have been approved system-wide throughout Essentia. I've been asked to really focus on grief support for today, but there's some more exciting things going on there. And just, strong leadership administratively with those daily COVID communications, that transparent information as there's things that are rapidly changing, and using Teams meetings, as others have mentioned, for people to be able to ask those frequently asked questions, to give suggestions, in real time, as a large system, and then really tremendously expanded wellness resources in addition to what EAP was already providing on our site.
So Gina, I want to pause. There's only a couple minutes. So do you want to just tell me when you want to flip through and hit some of the high points? I apologize.
Yep. Nope. You're doing great. And I have more information in my PowerPoint than we'd be able to cover in this amount of time. So are people able to get the PowerPoint so they have
Yes,
all that content? All right.
absolutely.
So I intended that you would have those links and those websites. So if we were talking about, you know, some changes, we are talking about creating some virtual staff support groups, as well as an employee support line, and hopefully Jackie can delve more into that, just in terms of, you can go ahead, well, creating EFA models, so that first aid model for all staff to have the benefit of those resources. And for those of you that maybe don't have training in grief per se, I really encourage you to go to some of those links that I put on there. There's a great 1 hour video by the Schwartz Center, that caring for yourselves and others during COVID, it's an hour well worth your time if you're not aware of that. So back to those 5 skills, it's a speed round. I would say if you walked away with one tool in supporting those who are grieving, is to learn how to be still within yourself. I know that many people are repeating that idea, but truly I could not do the work that I do without daily awareness of how this work is affecting me, and really working at grounding and modeling that calm when somebody's highly dysregulated. It's often not what we're saying, but just breathing with someone and listening and not interrupting. Or advice giving. That's the last thing that somebody wants in the midst of it. And also, just so you're aware, we don't use those old Kubler-Ross stages. Those died back at the 1960s. If you don't have some current information about understanding grief, there's some great resources out there. And that ptsd.va.gov has some great stress first aid resources as well. And I think praise people for what they are able to do, and listen for resilience and lean into that would be another takeaway. Very often people are very aware of the things they should be doing, or the ways that they feel like they're not functioning well, but to be able to have conversations about what has helped you get to this point so far, what's helping you cope right now. I think having that here and now, what works for them might be different than what works for us, and to be respectful of that would be another key takeaway. I know we're at 1 o'clock right now. Is there a parting question that anyone has? And feel free to look through my PowerPoint. There's more information in there, but any burning questions?
So I'm going to distribute. Thank you, Gina. That was fantastic. And she did have more grief support services and some tips for all of you. So I will pass it along. And if you have questions, pass them to us. We'll get them to Gina, or she has her contact information in those slides. And I think we definitely need a part 2 of this conversation. So we'll plan for that. And I know Essentia also has other things to talk about, but I think the grief support services, we want to give it just time and continue that conversation. Thank you to all the presenters today. This has been fantastic. Just a quick note, the website is up, and Tanya has done amazing work kind of redesigning it, and so she'll send it out to you. The webinars will continue, but we've changed them to be twice a month, the first and third Wednesday of every month, and we'll start that starting on May 20th from 12 to 1 still. There is a COVID Echo offered by Little Falls on Tuesdays and Thursdays from 12 to 1, which is a little bit of public health plus clinical information. And for those of you who are interested, we wanted to give you the opportunity to participate in that and not have a conflict. So we have moved this to Wednesday from 12 to 1 starting May 20th. We presented at ENRI yesterday, the national kind of regional health collaboratives where people come together. So there were people all over the country, really excited about the work you're doing. They had some good questions. So we'll share that with you at the next meeting. And we're hoping to extend the conversation to get some national speakers to hear how some people in different stages of COVID have dealt with some of these issues as well. So we're excited to continue going and kind of make this reach even bigger and extend the conversation. And until then, just take care, enjoy the little snippets of spring we're starting to get. We'll send you what the next theme day is, and I hope you all participate because I think that sounds super fun. And until next time, thanks everybody for attending, and thank you to our presenters. Bye.